Hello friends, this is Nishant Gautam, Associate Professor from the Department of Pharmacology, Laurel Institute of Pharmacy. Today we will discuss about the diuretics. Already we made the discussion of the diuretics in the previous two parts. The remaining portion of the diuretics we will study in this third part. So, the second class of the diuretics is medium efficacy diuretics, or also called as the thiazide and thiazide-like diuretics. Actually, this is the inhibitors of sodium chloride synthase. Just to remember this diagram in which we already discussed about the site 3, which is the prime point where it shows its action. This one is the site 3 having the sodium chloride symbol. The thiazide and thiazide-like drugs or the diuretics inhibits the sodium and chloride symbol at the site 3 of the nephron. These are the medium efficacy diuretics with primary site of action in the cortical dilating segment or the early distal tubule, that is the site 3. Here they inhibit the sodium chloride symbol at the luminal membrane. They do not affect the corticomedullary osmotic gradient, indicating the lack of action at the medullary thick ascending loop of the helix, so that the positive free water clearance is reduced because tubular fluid is not maximally diluted. So, very dilute urine cannot be passed in the absence of antidiuretic hormone. Now, let us go through the mechanism of action. These drugs are secreted by organic anion transporter present at proximal tubule cells. Then reaches to the cortical dilating segment or the early distal tubule along with the luminal fluid, where it inhibits the sodium chloride symbol in the early distal tubule. It results in the decrease in sodium and chloride absorption, so that there is an increase urine passed, alkaline urine rich in the chloride produced. Further, in addition to this, these thiazides and thiazide-like diuretics shows the weak carbonic anhydrase inhibitory action. In addition to this, these medium efficacy diuretics, thiazides, shows their mechanism by the inhibition of sodium and chloride synthetase that we can understand in more detail with the help of this diagram. So, this is the early distal tubular cell. In this early distal tubular cell, there are the two sites. One is the luminal site and another is the basolateral site. At the luminal site, the sodium chloride synthetase is present. The sodium chloride synthetase facilitates the movement of the sodium and the chloride from the luminal side towards the basolateral side. What happens? The thiazides inhibits this sodium chloride synthetase. Once this sodium chloride synthetase is inhibited, so there is the inhibition of the movement of the sodium and chloride from the luminal side towards the instrumental side. It results in the more excretion of the sodium and chloride through the lumen, and in this manner this thiazide is showing its diuretic action. So in continuation with this, let us discuss the some other actions of thiazides. Thiazides additionally shows the carbonic anhydrase inhibitory action. So there is an increase in the HCO3 negative and PO4 3 negative excretion. Thiazides also reduces the glomerular filtration rate by reducing the blood volume and by inducing the intrarenal hemodynamic changes. Note this point: the thiazide reduces the glomerular filtration rate by reducing the blood volume and by inducing the intrarenal hemodynamic changes. That's why not effective in the patients with low glomerular filtration rates. So in such patients, we are not utilizing the thiazide as diuretics. The extrarenal actions of thiazides are: it is developing the slow fall in the blood pressure, also or along with the elevation of the blood sugar level is the another action of the thiazides. Now let us go through the pharmacokinetics of thiazides. The thiazides are well absorbed orally. The action of thiazides start within 1 hour and the duration is up to 6 to 48 hours depend on the type of the drugs. For example, hydrochlorothiazides shows the duration of 6 hours, whereas chlorothalidone shows its action of duration up to the 48 hours. The variable distribution depends on the lipid solubility, whereas the eliminated mainly unchanged in the urine, and the elimination is from the 3 hours to 4 hours. Now, what are the therapeutic uses of the thiazide and thiazide-like diuretics? These medium efficacy diuretics are used to treat the hypertension, and the first line of the drug is chlorthalidone. It is also used to treat the edema. It is used to treat the diabetes insipidus, mainly the nephrogenic diabetes insipidus. It is also used to treat the hypercalciuria with recurrent calcium stored in the kidney. Now, let us discuss the adverse drug reaction of loop diuretics, thiazides, and thiazide-like drugs. The loop diuretics and thiazides shows a lot of adverse drug reactions. In this table, I summarize the adverse drug reactions of both the diuretics, and we can also compare the adverse drug reaction of both the diuretics. First, consider the hypokalemia either caused by brisk diuresis or by the low dietary potassium intake. So, in case of this loop diuretics, it is another adverse drug reaction is the acute saline depletion. It may be either due to dehydration, fall in the blood pressure will fall, direct fall in the blood pressure. Hemoconcentration, venous thrombosis. It is seen with the overuse of the loop diuretics. But on another hand, in case of thiazide, it is not so common. The next, third adverse drug reaction is the dilution hyponatremia. It is in case of loop diuretics, after vigorous use of the loop diuretics in case of congestive heart failure, but it is very rare with the use of the thiazides. The fourth adverse drug reaction is gastrointestinal tract and CNS disturbances. It is common in case of both the diuretics, that is the nausea, vomiting, diarrhea, headache, giddiness, weakness, paresthesis, impotence. And the another additional adverse drug reaction is hearing loss. This adverse drug reaction is only with the loop diuretics. In addition to this, the allergic manifestations. The allergic manifestations are common in both the diuretics, loop diuretics, and the thiazides, like rashes, photosensitivity, blood dyscrasium. Rare it is, especially in the patient hypersensitive to the sulfonamides. In continuation to this, the hyperuricemia. In case of loop diuretics, we have to avoid the probenecid. But in case of thiazide, the long-term use of high dose of thiazide is responsible for hyperuricemia as an adverse drug effect. The another adverse drug effect is hyperglycemia and hyperlipidemia. No evidence is there with the use of loop diuretics, but minimal with the low dose of the thiazide used as these hits. Another important adverse drug reaction is hypocalcemia. It is seen in the chronic administration of loop diuretics, but in case of thiazide, rises the serum calcium level may cause hyperkalemia. If you will see the magnesium depletion as an adverse drug reaction, it is common in the both diuretics. It is seen actually after the prolonged use of both the diuretics, either loop or the thiazide diuretics. But if you will talk about the renal insufficiency, the renal efficiency can be seen in the use of the loop diuretics, but aggravated due to the decreased glomerular filtration rate in case of the thiazides. Now, let us go through the loop diuretics and thiazides interactions. Both potentiates all other hypertensives, as it induces the hypokalemia. So, enhances digitalis toxicity, increase the risk of cardiac arrhythmia, and reduces sulfonylurease action or the oral hypoglycemics action. Mainly the oral hypoglycemic sulfonylurease action. additive ototoxicity and nephrotoxicity of aminoglycosides is the another important interaction. Further, there is the higher incidence of thrombocytopenia when combined with cotrimoxazole. The action is reduced when used with indomethacin and other non-steroidal anti-inflammatory drugs. Probenecid and diuretics reduces each other's action. The serum lithium level rises. So that's all for the day. We will continue the same chapter in part 4. Till then, revise the topic from the book. Have a nice day and